If you find your blood sugar rising despite following your medication and diet plan perfectly, it's important to understand that this is a common issue rooted not in what you are eating or the medications you are taking, but rather in a factor that is often overlooked: the hydration status of your cells. As we age, especially after 60, the way our bodies manage water changes significantly, affecting how insulin functions in our bodies. Insulin's job is to help glucose enter the cells, but if the cells are dehydrated, they become rigid and resistant, preventing glucose from being absorbed properly. This causes blood sugar levels to rise even when you have done everything right with your diet and medication. Many people mistake coffee, tea, or juice as adequate hydration, but these fluids either act as diuretics or contain sugars that can spike blood sugar, making them ineffective for cellular hydration. Drinking plain, room temperature water with the right timing and minerals is crucial to help cells absorb glucose efficiently. The medical system often overlooks this because hydration is not a treatment that comes with a drug or procedure, but the truth is that hydration is foundational to managing blood sugar effectively. There are 4 key hydration windows during the day that help stabilize blood sugar. First thing in the morning after waking up, about 30 minutes before meals, mid-morning, and mid-afternoon as small hydration breaks, and a final small glass 2 to 3 hours after the last meal to support overnight kidney function. Drinking during these windows with mineral-enhanced water can improve blood flow, reduce stress hormone-driven glucose release, and slow carbohydrate absorption, leading to more predictable blood sugar levels. This approach is not about increasing the total amount of water indiscriminately, but focusing on timing, quality, and mineral content, which together create the right environment for insulin to work effectively. Dehydration, even mild, stiffens cell membranes, making the insulin key unable to turn the lock on the cell, which is why blood sugar can rise even with perfect diet and medication adherence. Common mistakes include drinking ice-cold water, which constricts blood vessels and slows glucose uptake, counting coffee or juice as hydration, and waiting to drink only when thirsty, which is a late sign of dehydration, especially in older adults. Aging reduces the sensitivity of cellular water channels called aquaporins, decreases kidney efficiency in conserving water, and weakens thirst signals, making it easy to become dehydrated without obvious symptoms. Moreover, many medications for blood pressure and diabetes increase water loss, compounding the problem. Proper hydration supports not only blood sugar control, but also benefits kidney function, blood pressure regulation, digestion, skin elasticity, sleep quality, mood stabilization, and overall energy levels. When hydration is optimized, many people find they can manage their blood sugar better without immediately increasing medications or imposing stricter dietary restrictions. This method does not replace prescribed treatments, but enhances their effectiveness by restoring the internal environment your body needs to respond properly. The improvement is gradual and requires commitment, with noticeable benefits often appearing within 2 to 3 weeks and more significant A1C changes visible after about 3 months. Success involves tracking hydration windows and blood sugar readings consistently, ideally with a simple notebook, to observe patterns and stay motivated. It is also helpful to have a support partner to encourage adherence. Adjustments may be needed for people on diuretics or with kidney disease, and all changes should be made under medical supervision to avoid risks such as overhydration. This approach is simple, sustainable, and can transform the way your body manages glucose by addressing a root cause often ignored. Many people experience less blood sugar variability, better mental clarity, stable energy, and improved overall health by practicing structured hydration with mineralized water at the right times. It is important to dispel common myths, including that thirst is an early indicator of hydration needs, that water dilutes digestive enzymes negatively, and that hydration can be fully met through food alone. Seasonal factors also influence hydration needs. Indoor heating in winter causes hidden dehydration despite lack of sweating, while summer requires attention to electrolyte replacement due to increased sweating. Proper hydration can even reduce medication requirements, as better blood pressure control and glucose regulation lessen the need for higher doses under medical guidance. The emotional toll of blood sugar instability can cause frustration, guilt, and exhaustion, but understanding and addressing hydration gives you control back and helps break the cycle of blame and restriction. By creating a stable internal environment, your body can heal, insulin sensitivity can improve, and glucose can be managed more effectively. This is not a quick fix, but a foundational lifestyle change that supports sustainable health, resilience, and quality of life as you age. Starting with one hydration window per day and gradually adding more allows your body to adapt without overwhelm. Use filtered or clean tap water with added minerals, such as a pinch of sea salt or mineral drops to enhance absorption. Avoid cold water and beverages that act as diuretics or spike blood sugar. Remember, consistency matters more than perfection. The goal is to create a predictable pattern your body can rely on. Over time, this stabilizes blood sugar readings, reduces variability, and supports better medication response. Many people report improved sleep, mood, kidney function, digestion, and skin health as additional benefits. This simple, science-based approach is powerful because it targets a fundamental physiological need often ignored in diabetes care and general wellness advice. By focusing on hydration quality, timing, and mineral balance, you empower your body to function optimally. This makes all other efforts, diet, exercise, medication, work better. The foundation of good blood sugar control and healthy aging rests on well-hydrated cells. Embrace this practice as part of your daily routine, and over weeks and months, you will see meaningful improvements that bring balance, reduce stress, and enhance your quality of life. Maintaining proper hydration is one of the most overlooked yet crucial aspects of managing blood sugar and overall metabolic health as we age. While much attention is given to diet, exercise, and medications, the simple act of drinking the right kind of water at the right times can profoundly influence how your body responds to insulin and processes glucose. The underlying reason is that hydration directly affects the cell's ability to take in glucose. When cells lack water, their membranes become less flexible and less receptive to insulin, which means glucose remains in the bloodstream instead of being used for energy. This leads to elevated blood sugar levels, even when food intake and medication adherence are on point. This disconnect often leaves people feeling confused and defeated, thinking their efforts are failing, when in fact the root cause lies in cellular dehydration. The human body is about 60% water, and cells rely on a delicate balance of fluids and electrolytes to function correctly. Electrolytes, minerals like magnesium, potassium, and sodium, play a vital role in maintaining the electrical signals that allow insulin to open the gates of cells for glucose absorption. Without these minerals, even drinking plenty of plain water may not be enough because the signal to the cells weakens. This is why adding a pinch of sea salt or mineral drops to your water can make a significant difference. It is a natural, simple way to boost the effectiveness of hydration and improve blood sugar regulation. Aging brings physiological changes that make hydration more challenging. The aquaporins, specialized channels in cell membranes that facilitate water intake, become less responsive. Kidneys, which regulate water balance by filtering blood, become less efficient. Thirst perception diminishes, meaning older adults often do not feel thirsty until dehydration has already set in. Additionally, many common medications prescribed for blood pressure, diabetes, and other chronic conditions increase fluid loss by acting as diuretics. This combination creates a perfect storm where dehydration quietly worsens blood sugar control without obvious symptoms like dry mouth or extreme thirst. A key misconception is that drinking large amounts of water sporadically will compensate for dehydration. However, timing is crucial. Drinking water at strategic points during the day ensures that your cells stay hydrated consistently, supporting ongoing insulin sensitivity and glucose uptake. The 4 recommended hydration windows help maintain a stable internal environment upon waking, before meals, mid-morning and mid-afternoon, and a little before bedtime. This structured approach helps counteract the natural decline in hydration mechanisms that occur with age. Another common mistake is consuming cold water, especially first thing in the morning. Cold water causes blood vessels to constrict, reducing circulation and slowing glucose absorption. Room temperature or slightly warm water is better suited for cellular hydration and supports smoother glucose regulation. Similarly, beverages like coffee and tea, while enjoyable, act as diuretics and should not be counted toward your hydration goals. Juice and sugary drinks not only fail to hydrate properly, but can also spike blood sugar levels, defeating the purpose. Many individuals experience frustration because their blood sugar readings are inconsistent or unpredictably high, despite strict adherence to medication and diet plans. This variability often stems from dehydration-related insulin resistance, which causes the body to respond differently on different days, depending on hydration status. By improving hydration quality and timing, blood sugar readings become more consistent, reducing stress on the body and the emotional burden on the individual. Improved hydration also supports other bodily functions critical to managing chronic conditions. Properly hydrated kidneys filter blood more efficiently, reducing the workload on the heart and lowering blood pressure. Well-hydrated skin remains elastic and resilient, while digestion improves as hydration aids nutrient absorption and prevents constipation, a common issue for those on diabetes medications. Sleep quality often enhances, since dehydration disrupts sleep cycles, and mood stabilizes as the nervous system calms with adequate fluid balance. It is important to recognize that hydration is not a quick-fix solution, but a sustainable lifestyle change that complements all other aspects of health management. The body requires time to adapt to improved hydration practices. Initially, increased urination is normal as the body recalibrates its fluid balance. Within weeks, however, most people notice reduced blood sugar variability, better mental clarity, and more stable energy levels. Over months, lab tests such as A1C show measurable improvements, reflecting longer-term success. Tracking your hydration and blood sugar is a simple yet powerful tool to stay motivated and observe progress. Using a basic notebook to record your water intake during the 4 hydration windows alongside your fasting and post-meal glucose readings creates visual proof of the connection between hydration and blood sugar control. This tangible feedback encourages consistency and helps identify any adjustments needed, such as timing tweaks or mineral additions. Support from family or friends can significantly boost adherence and success. Having someone to remind you, share progress with, or even participate in the hydration routine creates accountability and makes the practice more enjoyable. This shared commitment often leads to improved health outcomes for everyone involved. While hydration greatly aids blood sugar management, it is vital to consult healthcare professionals before making significant changes, especially for people with kidney disease, heart failure, or those on medications that affect fluid balance. Medical supervision ensures safety, particularly in adjusting medication dosages that may be impacted by improved hydration. Seasonal changes also affect hydration needs. In winter, indoor heating removes moisture from the air, causing hidden dehydration despite the absence of sweating. Many people mistakenly reduce water intake in cold weather, worsening blood sugar control during these months. Conversely, summer heat increases sweating and electrolyte loss, making mineral supplementation even more critical to maintain cellular hydration. The emotional impact of struggling with blood sugar control can be profound. Feelings of guilt, frustration, and helplessness are common among those managing diabetes or prediabetes. Understanding that hydration plays a foundational role shifts the perspective from self-blame to empowerment. It highlights that the body is not failing you. It simply needs proper support to function optimally. This insight can relieve stress and motivate a more positive and consistent approach to health. Ultimately, hydration forms the cornerstone of metabolic health and healthy aging. It enables your body to use insulin effectively, maintain steady energy, support vital organs, and improve quality of life. By adopting simple, science-backed hydration practices, you lay a strong foundation for all other health efforts to succeed. This approach is accessible, affordable, and impactful, providing a pathway to better blood sugar control and overall wellness without adding complexity or burden. In summary, drinking mineralized, room temperature water at specific times throughout the day supports cellular hydration, enhances insulin sensitivity, stabilizes blood sugar, and improves multiple aspects of health. This knowledge is essential for anyone seeking to manage blood sugar more effectively, especially as they age. It is not a replacement for medical treatment, but a vital complement that addresses a root cause often ignored in diabetes care. Embracing structured hydration is a realistic, sustainable strategy that can transform your health journey, offering renewed control, resilience, and hope for the future.